Good evening, one and all. I'm Dr. Kiran Jadwani and I'm pursuing my MBA Hospital Healthcare from Symbiosis. We saw a lot of discussion on cloud computing as Mr. Sahani have spoken about it, and I would just give my views on simple views on cloud computing as much knowledge I have. So we start with the beginning, which is this is the agenda where I'll speak about modern healthcare organization, what it looks like, its need, healthcare which I believe is isolated and disconnected, what is cloud computing, healthcare in the clouds, benefits and challenges, and front runners. The last is the takeaways. So first, this all we know that the estimated annual IT spending within existing hospitals in India is approximately US dollar 191 million currently and is expected to reach a mark of US dollars 1.5 billion by year 2020. And right now in our hospitals we use electronic health records, electronic medical records, personal health records, and up to some extent electronic prescribing, financial billing, administrative systems. I believe that healthcare in India is isolated and disconnected because we have insurance, we have hospitals, we have providers, we have patient pharma, clinical trials. These are not connected. We have so much of data accumulated in our modern organization because modern organization consists of where there are different providers, where we get all services in single organization, and there is a lot of data accumulation because we cannot integrate this data because of the lack of common infrastructure. Paper-based, still some of the hospitals are practicing paper-based manual records, which are easy to lose and difficult to save. Those are inefficient, time-consuming, old, and expensive. Of course, every problem has a solution, and for me, I believe the solution is cloud computing, where because hospitals, the main area for them is patient-centric. The hospital has to give care to the patient. So that should be patient-centric with lab diagnostic, hospitals, care providers, insurance, pharma, clinical getting connected. By cloud, we can, implementing cloud computing, which will be inexpensive, connected, easy, and it will support mobility. Now, cloud computing evolution. I know everyone over here will be aware about because people are from the IT industry, but still, it started with 40s where we had punch cards. In 70s, we had mainframes, and 80s brought about revolution in the IT with personal computers. And now we have cloud computing where because we have to do a lot of data transfer, which is a must in healthcare. What is cloud? Cloud is actually a metaphor for the internet. It is the realization of a real-time consumption model where enterprises pay only for what they consume. This is the most important thing which we need to realize, that pay only for what they use, with rapid provision of resources as needed, completely transparent to the applications and its users. Right now we were discussing about the cost effectiveness of the hospitals. I think so. I personally believe that with application of the cloud computing, we can reduce the cost to some extent. Cloud has its anatomy, which has its essential characteristics, service models, deployment models. The essential characteristics are measured services, rapid elasticity, on-demand, self-services, broad network access, and resource pooling. Rapid elasticity is one of the important characteristics of the cloud computing for hospitals as regard to their infrastructure, the IT infrastructure. There are 3 service models: software as a service, platform as a service, infrastructure as a service. And deployment models are public, private, hybrid, and community. Most of the hospitals in India use private clouds. Now, why this chart explains why do we need cloud computing. If we go at the traditional IT approach, we see that the user's need and the IT resources do not match. Whereas in a cloud approach, whatever is our need, we go according to that is cost effective. This is a cloud architecture which explains what is actually private cloud, how is public cloud, and how is a hybrid cloud. Hybrid cloud is something which will connect private and public both. The benefits are supply chain benefits, as Mr. Sahani already discussed, scalable infrastructure, collaboration, and accessing insurance details over the cloud. The challenge is, of course, first and foremost is the legal challenge. That is the patient privacy and security of the patient data. Cloud computing for healthcare will need to have the highest level of availability and offer the highest level of security in order to gain acceptance in the marketplace. And HIPAA and the HITECH are the two acts which are applicable in US as of now. In public sectors, this is what I think, and I have known that if we empower ASHA, the workers under NRHM, and to use custom-built tablets connected to cloud for updating